In November last year, the House of Representatives Standing Committee on Health, Aged Care and Sport delivered its bipartisan report, The New Frontier, delivering better health for all Australians, on the approval processes for new drugs and novel medical technologies in Australia. Australian Health Journal spoke to some of the industry bodies who were part of the inquiry for their comments on the process, the report, and hopes in the recommendations being implemented.
My name is John Zalcberg. I'm a professor of medicine at Monash University, and I'm a clinical medical oncologist, consultant medical oncologist at Alfred Health with an interest in gastrointestinal cancer. I'm on the board of ACTA, but I think at the time that we submitted this document to the Standing Committee, I was the chair of ACTA. But in May of this year, I stood down as chair, and Professor Steve Webb is the current chair of the Australian Clinical Trials Alliance, or ACTA. There are a very extensive list of recommendations, of course, which need to be considered by government. But from an ACTA perspective, I was very pleased to see that the Zimmerman inquiry felt that further support for clinical trials networks was really important. It's worth noting that there really isn't a simple way for networks to be funded for their core infrastructure. Essentially, to bring these group of people together to think about how they're going to prioritise questions, how they're going to conduct trials, and learn from the wisdom, if you like, of their cumulative experience. That isn't straightforward. The actual trial itself is fine. That can be funded through NHMRC or MRFF, although the success rates for NHMRC are appallingly low for clinical trials these days, unfortunately. But nevertheless, at least there is a mechanism to source some funding. There isn't really a simple mechanism for clinical trials networks to source support for the infrastructure that makes them run. And I think that's a really important thing to understand. It's often people, but nevertheless, certainly the parliamentary inquiry saw the benefit of clinical trials networks and did recommend that they were supported, I think including specifically making reference to a clinical trial network in Indigenous health, which we've also identified as a really important priority. But there are a number of areas of medicine in which there aren't networks, and it's worth noting at this point that there's about a 5 to 6-fold return on investment for every dollar invested in clinical trials networks or trials run by networks. So it's a financially really sensible thing to do from a healthcare perspective, and we've demonstrated that across 3 networks and 20 trials. Begs the question of what about implementation? It's all very well to have an answer to the question, but will it be implemented in the real world, as we've discussed? My view is that clinical trial networks are an incredibly powerful way of ensuring that implementation actually does occur. And if you think about this, if you actually bring a group of people together to work out what are the important questions in managing a newborn baby, what are the important questions in treating lung cancer, what are the important questions when someone requires emergency ambulance care. If you bring people together to think about those questions, they prioritize those questions, and they then start to think about clinical trials that actually will allow the question to be resolved. Because that's what we want to do, right? We've got a question in medicine, we're not sure what the right answer is, we do a clinical trial, we answer the question, and we move on. But we only move on effectively if we implement the answer to the first question in order to ask the next one. And our view about this, and we've seen this time and time again, is that if you engage clinicians in the question, so they think this is important. It's not that I think it's important. It's not that the hospital down the road thinks it's important, but we as a group think it's important. Then we are much more likely as a group to implement the answers to those questions. And clinical engagement is key here, key to being involved at the outset. And then, as I say, I believe that there is increasing evidence that clinicians will then be involved and engaged in the implementation moving forward.
Hi, I'm Shanny Dyer. I'm the CEO of ARCS Australia. So ARCS Australia is an organisation for professionals that provides education opportunities and represents our members and other stakeholders who are involved in the research, development and lifecycle management of therapeutic goods. This is to raise quality standards in the sector and improve healthcare outcomes. ARCS was keen for government to do the things that governments have the power to do. So that's to listen to people and then implement the systems and processes that will assist all Australians to have access to the best medical innovations globally. And the report confirms that that will be the case. It will do it via the implementation of new nationally developed digital platforms, nationally framed policies and procedures, standards and guidances. This is the way that government can help. So examples of this from the report was the recommendation for a national digital platform for clinical trials. These have been spoken about as the front door and the one-stop shop. ARCS also recommended that the TGA be given technology upgrades and support its advanced therapies group, and these were also confirmed. So we were very pleased about that. And then importantly, reform of the HTA system, so the health technology assessment. So noting that with new technologies such as precision medicines, genomics and software as a medical device, the system needed to change, and this is being done. So we were pleased to see that they've recommended also a Centre for Precision Medicine and Rare Diseases. I think quietly confident. So many of the recommendations were already in train, and by documenting them in this bipartisan committee report, I hope that means these initiatives will have legs, a body, head and arms.
I'm Leanne Wells. I'm the CEO of the Consumers Health Forum of Australia, the national voice for Australian healthcare consumers in all national policy debates. The terms of reference to the inquiry were incredibly expansive, so I can't cover all of our recommendations here, but some of the key ones for us, and these reflect the views of many of our members, were the importance of developing a framework to guide or govern the introduction of medications and medical technologies, but with clear guiding principles in particular for new drugs and novel medical technologies and the interface between them. We think that's vital. We think that to avoid waste of effort and duplication in regulatory and health technology assessment processes, any framework should feature a single point for industry to engage with timely scientific advice, to work collaboratively with consumers to access and understand real-world data around co-design and disease-specific relevant measures such as patient-reported outcomes and experience. We think a global network to connect information systems would be really helpful to capture and analyse that real-world data. That should better inform the public, but ideally add value to health technology assessment decision-making. We focused on evaluation and improvement. The current PBAC assessment of medicines is a rigorous process, but we think it inadequately considers the evaluation of social and economic impacts of a particular intervention. They're therefore, producing arguably some gaps in the assessment process. As well as new and novel, we need to look at new uses and novel uses for existing medicines and other technologies. So the development of vaccines and treatments for COVID-19 and long COVID, for example, have been based on novel uses for existing medicines and other technologies. So repurposing existing therapies may allow patients faster access to medicine. So it's not always about new and novel. And this is just to highlight some of our points, we also supported the calls for others for incentives for pharmaceutical companies to invest in domestically based clinical trials. We think that needs to be strengthened, and we need to couple that with measures that address the low levels of health literacy in Australia, which mean that clinical trials are not often well understood by consumers, and as a result, consumers are hesitant to participate. So really promoting initiatives like the George Institute's Join Us register, we think is a great initiative. So there's a whole spectrum of recommendations we made that just gives you a flavour of some of the things we spoke about in our submission. The 31 recommendations in the report we felt were comprehensive. We welcome most of them. There are some interesting points in there around genomic screening, standardisation of clinical trials. There's some good aspirational goals in there. The recommendations recognise the lack of transparency and lack of access for many patient groups. But, so overall, a comprehensive welcome report that'll contribute to the National Medicine Policy Review currently underway. I suppose our only concern is that some we feel could result in greater complexity, bureaucracy, and create more silos. That would probably be our only red flag. The report has been tabled in the House of Representatives, and the federal government is yet to consider whether or not they're going to take up any of those recommendations. It'll be a major contributor to the National Medicines Policy currently under review after 20 years. So we think that's the main gain. We don't know what both sides of government are going, where both sides of government are going to land on that. But what we'll be doing is pressing for recommendations from the National Medicines Policy Review, given that's going to be the document that sets down the foundations for medicines policy and related programs into the next decade. We want that to be supported on a bipartisan basis.
Hello, I'm Liz De Soma and I'm the CEO of Medicines Australia, which represents the research-based pharmaceutical industry. Well, Medicines Australia really focused our recommendations across 4 key areas. The time and timeliness to access of new medicines. That means new medicines, that biotherapeutics, new technologies from the Australian regulatory system through to subsidised access. Research and development, and with a particular attention on clinical research and development opportunities, as well as looking at intellectual property research and development tax incentives. And also a really critical point, the role of the consumer in decision-making, how important it is to have the patient-reported outcomes and the views of the consumers included in decision-making. And then the 4th theme was around real recognition that Australia is part of a global context and that policies in Australia may influence policies internationally and vice versa. Things that are happening in the international environment can have a very real impact on access to medicines in Australia. Well, as you know, there were over 30 recommendations in the report and multiple sub-recommendations. So there are a number of things that captured the intent of our submission. Modernising the health technology assessment system is one, harmonising health technology assessment across different areas, including a Medical Services Advisory Committee and National Blood Authority, for example, strengthening the call for action on streamlining and harmonising clinical trials. Recognition that data exclusivity is an important element in making decisions on Australia's competitiveness for translating research and development into commercial products in Australia. Really leveraging Australia's competitive advantage. It really does reflect that there is a lot of common ground between what the industry wants, what the patient groups want, what clinicians want, and what the whole system is looking for. In Medicines Australia's strategic agreement, we have highlighted the need for robust and rigorous consultation across all stakeholders to see if we can come to some agreement on how this can be achieved.
Hi, I'm Ian Burgess, CEO of the Medical Technology Association of Australia, or MTAA, and we represent suppliers, manufacturers, distributors of medical technology in Australia. And our companies provide the majority of non-pharmaceuticals used in Australia to treat patients, to save lives, extend lives, and provide patients a better quality of life. MTAA put in a comprehensive submission to the inquiry, and we also appeared and provided evidence in person, as did quite a number of our member companies. And our comprehensive submission, I think there were probably around in the order of 30 key recommendations. And then when you break that down, probably in the order of around 60 plus recommendations in there. So it was comprehensive, and it's within the context that whilst we do have a very good quality health system in Australia, clearly there are opportunities for improving our health system. And the key parts to that are improving our regulatory and reimbursement pathways, better coordination between that along the pathway from entry to market through to being able to be accessed by a patient. In improving our clinical trials frameworks, our R&D capability, and particularly to ensure that we have a greater voice of patients in our HTA, our health technology assessment processes. And there's a raft of detail underneath each of those. And for example, with the TGA and our regulatory processes, TGA is a world-renowned, very high-quality regulator. But again, as with our health system, there are clearly opportunities for improvement that are all about ensuring that patients get faster access to life-saving and life-changing technology. This is an excellent report from a bipartisan committee that shows the benefits of a collaborative approach, not only just within Parliament, but also with the various stakeholders that contributed to the inquiry and provided submissions and evidence. Of key importance to the medtech sector were recommendations around improvements to the prostheses list. And the committee report highlights the need to ensure that non-implantables are included on the prostheses list. And this is a critical factor and a key recommendation to ensure that Australians can access innovative life-saving technologies and ensure that in the private health system, they will be able to access that and have it reimbursed by private health insurance. And that's currently a key value of the prostheses list. That sets the benefit levels that private health insurers are required to reimburse insured patients for devices that are on that list. And when a device is on that list, then as a patient, you have guaranteed access to that technology, and your doctor has guaranteed choice of the best device for you as a patient. And also generally, you can access that technology with no out-of-pocket costs. So broadening the prostheses list to include non-implantables really is a key factor in terms of ensuring that patients have access to new innovative technology. Another key part of the recommendation around the prostheses list was to also improve the coordination between two key parts of that regulatory process. One is the Prostheses List Advisory Committee, or PLARC, and the other is MSAC, or the Medical Services Advisory Committee, and ensuring that there is better coordination and processes between those key bodies. Again, that's essential to ensure that patients have timely access to technology. And the improvements that are recognised and recommended in the inquiry's report, many of those essentially are designed to ensure that patients have quicker access, that the approval pathways, the reimbursement pathways are simplified, duplication is removed, they're better coordinated, all to ensure that patients have faster access. Well, I think the fact that it has been a bipartisan report is a credit to the committee, and again underscores the quality of the final report. And there are very good recommendations in there. We think there's some that we would have liked to have been added in, and we'll certainly be seeking to progress some of those reforms, including in areas of direct relevance to medtech around MSAC, the Medical Services Advisory Committee, the PL reform process, but also more broadly in terms of clinical trials and other incentives to support innovation, R&D and manufacturing in Australia. But there are a number of great recommendations in the report, and the onus of responsibility is on everyone to ensure that report doesn't just end up sitting on the shelf. And that's both sides of the House in Parliament. And I think there's a strong commitment from the coalition and the opposition to do so. but also from the medtech industry, MTAA, and other associations and parts of the sector to promote the uptake of these recommendations.